So, Dr. Muthu, one student is asking what is the criteria to call volume loss?
What is the criteria to call a volume loss? So what happens if, let me open that case. I closed it, sorry. So let me share that screen again. Are you guys seeing a case screen?
Yeah.
Okay, let me open the Sakthivel. Just this is what I look at when there is presence or absence of fibrosis. So what happens in ILD related fibrosis is you can see the fissure. The fissure is undulating. You can see it is not as smooth as a straight line. When I see that, that is a first evidence of architectural distortion. Okay, that implies there is some kind of fibrosis is happening and there is evidence of volume loss. The other thing is the problem here is when you are not adequately inspiring, the lung will, even though the patient is having fibrosis, the lung parenchyma, the diaphragm will move all the way up, and that will pseudo-inflate the lung and increase the AP diameter despite having this. But focus on the presence or absence of architectural distortion as seen on the fissural movements. That itself says there might be some volume loss happening here. That's what I use, not just the presence of the AP diameter or the how the diaphragmatic positions. Look for evidence of architectural distortion. If there is architectural distortion, that is volume loss. That's how I differentiate, because these things are dynamic.
Thank you, Dr. Muthu. It was a fantastic case-based session. And you have answered all the queries in the chat box as well. So thank you for all the cases. Your clinical context and the approach to cases made this session very enjoyable. We all of us learned a lot of new things today. Thank you for your time. And I think we can conclude the session.
Okay, thank you very much, Dr. Apana and Dr. Taruna, to come on a Saturday evening, and special thanks to Dr. Taruna coming out on vacation. I'm glad it went well. I'm glad you guys enjoyed it. Please let me know if you guys have any suggestions or any other questions. Please feel free to reach out to me.
Getting a lot of feedback in the chat box. Great cases, cool cases. Thank you for your time.
Thank you very much.
Thank you very much, everyone. And thank you, Dr. Taruna. Thank you, Dr. Muthu. Just to remind everyone, next Sunday, we are having the ICRI Ski Synergy series. So everyone, please join us for that also. We'll be sending out the flyer soon. Thank you. Have a good weekend. Bye.
Thank you so much, everyone. And with all your permission, I'm closing the session here for today. Thank you so much.
Thank you.